Good afternoon, everybody. Welcome to the COVID-19 update for Eau Claire County. We're happy that, again, you're joining us for this opportunity to share with you what's happening in our community related to COVID-19, to give you update on data, and what the community is doing to prepare and respond. Happy Friday. It has been another long week for everybody, and thank you for what everyone's continuing to do to help make sure that we're stopping the spread and flattening that curve. As it is the 24th of April, it is the start of a new order. I will be talking about that a bit today, as well as going over some of the other updates that we have in the community. In Wisconsin, there are now 54,575 negative cases for COVID-19, an increase of more than 3,000 negative tests. There are 5,356 confirmed cases of COVID-19, an increase of 304 since Thursday, and 1,353 hospitalizations, about 26% of the total positive cases of COVID-19 in the state. Deaths are now at 262, an increase of 5 since yesterday. As we continue to see deaths across the state, including in this region, it reminds us that this is a serious disease, and it's important that we remember the families, and important that we remember that while there are specific risk areas, people that are particularly at more risk of serious issues with this disease, it is really hitting populations of all types, and we can't forget that. None of us are immune to COVID-19. We are seeing in the state evidence of increased testing, and we've been talking about that for some time. The capacity has increased, and we are seeing those increased tests happening. Obviously, evidence today with both increased numbers of tests, but also increased positives. Outbreaks across the state are part of that, but also the general capacity building statewide. The goal for the Badger Bounce Back initiative of the state is 12,000 tests per day in the state, so we are working our way toward that. And in Eau Claire, we now have 24 confirmed cases of COVID-19, an increase of 1 case since yesterday. Our testing numbers are at 1,742 people tested, 1,668 negative tests, and the remainder pending. Again, our call center continues to take calls. We are pleased to do that with questions that people across the community have around COVID-19. That call center number is 715-831-7425. The call center is open over the weekend for people's questions and concerns. A couple of updates related to things that are happening statewide and also in this community. The Badger Bounce Back initiative that was announced on Monday to get us to move from where we're at now, which is the Safer at Home order, to really progressively and smartly reopening the state, is looking at a lot of data and practices that we are improving over time. So again, surveillance of symptoms, looking at positive test cases as a percent of total cases, and really working on our healthcare resources so that we are sure that we can meet those needs if we have a surge. The positive cases as a percent of total cases in Eau Claire is now at 1.4%. But again, as we increase testing and possibly increase seeing positives, we'll see where that number goes. The state positive cases is at about 10% of cases of tests are positive. The Safer at Home order was extended starting today. The old order ended, and there are some new pieces to the Safer at Home order that are in place now with order number 28. As the Badger Bounce Back program and the Safer at Home order going together to get us back to safer reopening, it's really turning the dial to take a step in that direction and really also assure safety of our residents. New activities that are now open for starting today. Golf courses, for example, are now open with some restrictions. Libraries may be open for some curbside services, and I know our Eau Claire Library is exploring that. Essential businesses that have been open with the last order for those essential services have some additional guidance related to the numbers of people in the stores that will be instituted if they have not been doing that already. Non-essential businesses are now able, under the current order, to start processes like mailing product, curbside pickups, and deliveries. Arts and crafts stores may also have curbside pickup for supplies that could be used, for example, for fabric face coverings. Optional modeling and construction projects also can happen with one staff person per time working on those sites. And K-12 schools, as I think everybody already knows, are closed for the remainder of the academic year across the state. In Eau Claire, we've been answering a lot of questions from those businesses and groups that have wanted to be open and are now, with the new order, moving toward progressive reopening. We have information available on safe curbside pickup for those businesses, and we've provided information on golf course reopening. Those materials are on our website, and if people would like to look at them so they have a good understanding of how those two new operations can happen safely, please go to our website. Today in Wisconsin, our state was approved that families with students that receive free and reduced price meals at school will be able to access additional benefits. And as we get more information about that program, we will share it on our website. A reminder that there are several locations in Eau Claire County where school students that are in our county can get meals, and that information is available on a USDA website, and we will get that website link up on our site shortly. Yesterday, the health department, along with law enforcement and county and the administration from the county, as well as the city of Eau Claire and city of Altoona, did send a communication to our community about safety needed during any protests or public of large events that happen where people are exercising their First Amendment rights. Our ask is to be cautious. This disease is one that is spread by close contact, and in those environments, the risk is real. And our ask, and communicated in that letter from law enforcement, county and city leadership, as well as myself, was really an ask to pay attention to physical distancing, to stay home if sick, and to make sure that people are being very, very careful if they're choosing to be involved in those types of activities. We don't want to stop flattening the curve, and that's really what we need to do at this point. We also have been working, as we've said a couple of times, on testing issues locally. We know the state is increasing testing capacity, but we are working with all of our local providers on testing symptomatic individuals. We encourage people in Eau Claire County, if they have symptoms of COVID-19, to be interacting directly with their healthcare providers, problem solving where they can be tested, if that's appropriate according to the clinical review of their symptoms. We want to know who has COVID-19 in our community. Our job in public health specifically is to follow up on those positive cases and make sure they stay home and their contacts stay home so we don't have spread of disease. Testing will help us understand where disease is, and making sure we do good case investigation and contact tracing will help us minimize the spread of disease. All critically important things that are happening in our community now. We're fortunate that we have a strong healthcare system in this area. Our testing rates are good compared to most of the state, but are still not at the place where we need them to be. Again, the state is really working in their plan to increase testing substantially every day, and that's part of our goal as well. So 12,000 tests a day in the state is the goal, and we want a strong proportion of those to be in this service area as well. There have been some discussions at some recent national media events and a White House briefing that have prompted discussions locally about the use of various treatments for COVID-19. I really want to make sure that our population, people living in Eau Claire, understand not to use treatments that are not recommended by their healthcare provider or recommended by the CDC. They can be very, very dangerous. So please do not decide to move forward with something that is not recommended by a healthcare provider, including the use of UV light, including the use of ingestion of disinfection chemicals or other treatments. It's dangerous, and we want to make sure that people not only don't get COVID-19, but don't get sick or injured from doing something where they think they're trying to prevent or treat. If you are ill, call your healthcare provider, get tested if it's COVID-like symptoms, stay home, get rest and fluids, and treat those symptoms as you would normally. The Chippewa Valley Economic Recovery Task Force we talked about on Wednesday, that has been started and has interest and enthusiasm as a way to really pull together various sectors in our community, along with the people that have been working in incident command, to find ways to restart our economy successfully and with energy, and to do it in a way that is safe. So we are pleased that partners are coming forward to the table, are working, as Dale Peters announced on Wednesday, with a team of people to look at smart reopening in the Chippewa Valley in a way that really looks at the state metrics and what we need to do to not only contain disease, but to have safe and progressive ways of reopening, but also to support one another and to support the energy that exists in this community to really come back strong. We are fortunate that we have an amazing community that wants and needs to do that. And so really harnessing that energy and moving it forward is important. We are, as we've all said, a social people. It is our instinct to reach out. My continued ask of everybody is to make sure that you are reaching out in ways that are not going to make you sick and not going to make those people that you love sick as well. This is a disease that we don't have immunity to. We know that certain people are at higher risks, and that's why there's additional concern about people living in places like long-term care facilities and elderly, and we need to pay attention to that. We also know that being in those risk groups is not a 100% way of knowing who's going to be severely impacted by disease. We've seen people hospitalized across the state and dying across the state in all age groups. So it's important that we protect one another. I really thank you for all the work that's being done to be safer at home. This morning on my 6 a.m. walk with the dog, I saw some wonderful chalk messages on First Avenue, so thank you to the people that did that. And I know that that's happening around our community. We need to encourage one another, remind one another to stay safe, and while my instinct is to see people I know by chance walking around the community and give them a big hug, we need to not do that. Step back, greet one another, and make sure you're staying with your household. Again, our call center number is 715-831-7425. Our website is coronavirus.echhealthdepartment.org. And I can answer questions that people may have. Yes?
So the DHS started listing the number of recovered cases today on their website. Mm-hmm. So I'm assuming that comes from the county level. Is there any way you could tell me if the number of cases that have been recovered in Eau Claire County?
Sure. So the question is about recovered cases. DHS started today to report recovered cases. That's a new report that they are providing to the CDC overall from the data. It's unfortunately a very complicated measure that they pull from our electronic disease surveillance system. We were notified about that yesterday, so we do not have county-specific numbers yet. We are understanding that we will be having a standard report eventually run, so we'll be able to provide that information locally as well. At this point, it is not yet available. Our cases in Eau Claire, the 24, are in various stages of recovery according to the definitions that the CDC is newly using. And there are certainly some people from the beginning of this outbreak that are no longer considered infectious and are outside of when we are having them be isolated. Other questions? Yes.
You said before that you haven't said whether or not there are cases in nursing homes here in Eau Claire. Chippewa County has said, we don't have any cases in nursing homes. Can you comment on whether or not there are any cases in Eau Claire County in nursing homes right now?
So the question is whether or not we have any cases in nursing homes in Eau Claire County. We are working closely with nursing homes, as we've talked about before. They are a critically important group, and we are not sharing any specific details about the specific cases that we have in Eau Claire County. If there are outbreaks in long-term care facilities, that is reportable and certainly would be part of what we would message to the community. Yes.
Much like, in a different way, but much like long-term care facilities, there are specific challenges. Is that a concern, and are you working with those folks as well?
Sure. So the question is related to, are we working with various other congregate settings where people live together? They may not be under the technical definition of family, but they are group home settings, assisted livings, and certainly the long-term care settings. Eau Claire County Incident Command is working with all of those settings. It's an important part of what we do in any communicable disease, is that when you're living together, the likelihood that you may spread disease is definitely there. We have state guidance that we've shared with all of those facilities, so long-term care facilities, assisted livings, and group homes. And we are answering their questions. We are particularly focused right now on those larger congregate settings, so assisted livings and long-term care facilities. We have weekly, at least, meetings with the group as a whole, and regularly working through with them. There are very specific standards at a state and national level for those types of institutions, and it's critically important that those things are put in place. It wouldn't surprise everybody that many of those things are related to physical distance, hand washing, separating people that are ill, and all of those standard things that we talk about across the community, but particularly important in that setting. There are more than 50 group home-like facilities in Eau Claire County, so there are very many of them, and we are working progressively as questions come up, but also getting good basic information out to everyone.
Do those, in that 15 number, does that include nursing homes, long-term care, or is that specific to group homes?
Yeah, the question was how many of each of those different types we have, and I don't have specific information on all of the different types, but there are actually more than 50 group homes in Eau Claire County that exist, many more assisted livings and long-term care facilities. Our lists are very long, and we're working hard to communicate with all of them, but again, those are the types of facilities that we really want to provide good support to. Yes? So the question is, of the new cases that we have recognized this week, have any been related to the election? I am not aware of any of them having been related to the election, but it is a question that we do as part of our interview of that case. One of those cases was today, so we don't have that information, certainly for that one. And I'm not sure about the other case, but it is certainly something that we are asking. I know statewide they've identified a number of the newer cases connected to the election. Again, it's not causation, it's correlation. So it is cases that have indicated that they either voted or worked at the election, but we can't say with any certainty that it's related to the election, even for those that might have that connection also in Eau Claire. Certainly, any congregate setting is something that we see as a potential risk for transmission of disease, but we can't say with any certainty that any of the identified potential connections are actually because of that. We really had a lot of work happening related to the election to keep them safe in Eau Claire, and the team that worked through that really spent a lot of time and effort on it, which I think is very much to the benefit of all of us in any kind of bump related to that event in our community. Any additional questions? Again, thank you very much. So far in Eau Claire, we are really doing well, and that's really a credit to everybody in Eau Claire that's paying attention to the Safer at Home order. That is, despite this being difficult for all of us, understanding that we need to pay attention to this disease, it's serious. We've been able to keep the number of confirmed cases small. That number is going to grow. We know that as we progressively reopen, we will see more cases. The goal in all of this is not that we never see any cases again. It's really that we have as few cases as possible at the same time. You help us with that by staying home, by following the Safer at Home order. Thank you for what you've done recently and in the future to keep your circle small and not spread disease. Physical distance and staying home when you're sick are the two best things that any of us can do. So thanks. It's working, and we appreciate your effort. We'll be back on Monday and share with you again the update related to COVID-19 in Eau Claire. Thank you.